The reason I chose HMR program was because of the in-room support or in-house support, so that I could come to classes and learn, so that I don't make the same mistakes I've been making for all these different years. My health, I was on diabetes medicine and I was on high blood pressure medicine. High blood pressure I was on for around 15 years, and I'm completely off all my medications, so the greatest benefit for me is, for my health, is that. The program has met every expectation I could ask for. I enjoy going to the classes because there's the other members of the class, we talk and discuss what we've done during the week, and I like the education I get and the handouts that teach me how to eat right for the rest of my life. I decided to come to classes instead of staying home, just so that I have the accountability to myself, and I want to do better, and I want to more or less show off when I go to class that I've lost all this. Of course, it's gone down now, but I've lost a lot of weight. I've lost 16 pounds the first week. I refer a lot of people to the program. And the main reason I refer them is because if you're hungry, you eat. Because the slogan that I heard from the very beginning was more is better. And I didn't understand how you eat more and still lose weight. And I'm living proof. I've lost 120 pounds in 32 weeks. My friends and my family see how much more active I am, and that I just move better since I've lost this weight, and they just notice. They say I even look younger. People have said my hair has actually gotten darker, but I don't think so.
When I chose to come to the HMR system of the Physician's Health, my health was starting to deteriorate, and I needed to start eating healthier. So as a result of coming here, I'm eating healthier, and as a result of that, I am losing weight. I feel better, and I know I look better because I'm shopping in different stores and different sizes, and my health has improved. Actually, the program has exceeded my expectations because I had never had this much success before. The weekly classes, I never leave without learning something every single week. And it's exciting to learn new, and it's very just normal information that helps you throughout the week. I chose to come to the weekly classes because I had never been successful on my own before, ever. They see me, they see the results, and they always tell me, you look so much happier, you look so much better, you look like you feel good. So I really don't have to tell them very much. The changes people see in me is that I'm less stressed. But I don't have less stress in my life. I have the same stressors, but I can handle stress better now, and it doesn't seem like it's such an insurmountable task. And so I'm happier.
Well, my physician told me that if I didn't lose the weight, that I was either going to have a stroke or a heart attack. And that kind of scared me. And plus I had a friend that was in a program and she had lost a lot of weight and it seemed to work for her, so I thought I'd give it a try. Well, I've lost weight. I get to get a new wardrobe, and I feel better, and I'm off all my medications now, so that really helped me out a lot, and that was quite a bit, so I'm healthier. Well, the program's met all my expectations because I've done what they told me. It's a matter of you just follow it and do what they tell you, and you never get hungry. And so it's met everything I thought it would meet. Well, the weekly classes are important because you're accountable for what you do. You get to write things on the board and what you've done that week and what you've eaten. So it helps you keep things in writing, and you can follow a program better that way. And I enjoy the people, the camaraderie you get between each other, and you can tell them how you lost weight, and you can brag a little bit, and they get to see you. And it's quite dramatic when you first get in the program, the weight you lose. Well, I'm a diabetic, and so I needed to see the doctor quite often, and I knew he would be here. And I also needed accountability where I could check in, and I needed the food they had for me because I did not know how to eat. I'd never been overweight before, and I've always just been able to eat what I wanted and not gain any weight. And all of a sudden, now that I'm not so young anymore, everything's changed. Well, other people could see the weight I'd lost, and so it was easy to refer them to the program. And the food was all good. I liked all the food I had, so you could tell them about that, and you never get hungry on this program. And so willpower doesn't enter into it as much. Well, there've been a lot of changes. I've lost a lot of weight. I look better naturally. My wife said now she can take me out in public without being ashamed of me. And so that meant a lot to me, and I just feel better.
I joined the program because of the relationship I have between my brother and my sister. There had been no disease of any kind in our family history until about 8 years ago. My sister and my brother are older, and they were recently diagnosed with diabetes and heart disease. My sister was an undiagnosed diabetic. She was diagnosed after losing her sight and an amputation. My brother is in denial. He believes that he can eat anything and take a pill. I volunteer at the hospital, and I see a lot of ill patients, and I see a lot of complications because of diabetes and heart disease, and I didn't want to go there. And I knew it was time for me because a year ago, my last checkups, they were, the cholesterol and the sugar level was rising. I started the program, I lost my first 20 pounds, everything went down. I'd been on cholesterol medication, I didn't have to take medication for diabetes, but my doctor is so happy because I lost so much weight that I'm off cholesterol medication and I am not considered diabetic any longer. The program met my expectations dramatically because I was held accountable for everything that I put in my mouth. I kept a journal. I've lost weight, I'm healthier, I'm happier, and I get new clothes. The classes were good because you were held accountable. There's camaraderie there. You feel like it's a family atmosphere. No one is judgmental, and the teachers are terrific. I decided to come to the classes as opposed to trying the program at home because I did need to keep a record. I did need to be accountable. When I refer people to come to the program, I tell them my life story, and I tell them that I feel healthier and happier than I've ever been. And they're always commenting to me that I look so much better. I'm more outgoing, can you believe that? No. the changes that people see in me are that I am more happy, more outgoing, and also I'm better physically fit.
My mother had had great success with the program and actually bought my starter kit, and so that got me started. I did choose to start the maintenance classes because I wanted to make this a lifestyle and not have to continue on the program like I had and keep the weight off.
Excellent.
Besides the obvious physical benefits, I think I feel better when I'm exercising, I have more energy, I feel like the old me. Well, obviously the weight loss. The maintenance classes are going to be something that I'll use the rest of my life. Ideas and thoughts, and my favorite term, and I remember it all the time, especially when I'm trying to, maybe going to eat something I might not want to, I think about moderation and movement. If I can just remember those two things, it's all gonna work. I decided to join the in-clinic program for maintenance because I knew that I needed the support after I had lost the initial weight. I needed to lose that last 10 pounds, and I wanted, like I said, to make a commitment for a lifestyle, for a healthy lifestyle for myself and for my family. I think the first thing people see, obviously, is that you've lost weight. That's the first thing they notice. And then when I explain to them how easy it is and how it doesn't really interrupt your family, they think that they can do it and they try it as well. Our family, it has not in any way hindered our family for me to be involved with the HMR program. What we usually do at dinner time is, when I was on the Healthy Solutions, the full plan, what I would do was always have several fruits and vegetables that we were having with our main meal. I would fill my plate with the fruits and vegetables that I could have, and then I would add what we call a healthy meal to my plate. And so my plate basically looked like my family's. I wasn't really cooking anything extra. All I had to do was warm up my meal for the 1 minute. And we did refer to them as healthy meals at my house because I do have little girls and I really don't want to get them in the diet frame of mind. I want them to know that choosing to eat this way was to make mom and my mother, their grandmother, healthy. And so they were healthy meals, not diet meals. Well, I think I've been lucky because I didn't have health problems. Was I on the road to having health problems? Probably. But physical changes have been the most. I am happier with myself. I'm more content and more comfortable.